Good afternoon. Thank you for joining us. We want to give you an update on our COVID situation. I will start with some reasonably good news. When we started our vaccine distribution efforts in our county, we had set an initial goal we felt was aggressive at the time. We said in January we wanted to administer 250,000 vaccines. I can share with you that to date we have administered more than 269,000 vaccines. Obviously, we are going to continue to push and expand as rapidly as possible. In large part, our abilities to have sustained and significant increases is limited by the availability of vaccines, but we are hopeful that that situation will turn around and we will get a more consistent, steady stream of vaccines. But we will continue pushing aggressively ahead to build out more locations with more options and higher volume and make it easier for folks to get into that system. The other good news is demand for appointments still remains exceedingly high. The biggest complaint we get is people say, I can't get an appointment, and the minute that they are made available, they are gone. And while we know that is frustrating to folks who want to get it, it is encouraging overall at the demand of where we are. Well, the stay-at-home orders have been lifted with San Diego County now back in the purple tier, and with vaccine administration moving forward robustly, we know that we still have a fair amount of work to do as it relates to cases. We want to see continued effort of bringing down our positivity rate. We want to see the downward trend we've been experiencing in cases continue. And we have to do this all with the presence and awareness that a new, more contagious strain is in San Diego County, and that requires us to remain vigilant, to not be complacent, to continue to take all the necessary precautions to slow the spread, and to have some hope because of the vaccine and the increased numbers of vaccine, but to have that hope motivate us to be more diligent and more focused to lower the cases, because we know it is not something we will have to do forever, but we are going to be in the posture of assessing case counts and hospitalizations and having those numbers drive what can be open for a while. And so we want those cases to come down. We want to go from the purple tier to the red tier into the orange tier and rapidly work our way out of the situation as a county. As I mentioned, we will show in a moment on our dashboard that we have administered 269,218 doses of the vaccine. I want to thank our county staff at sites. I want to thank in particular our healthcare partners who are both working with us at many of these sites and are also doing vaccinations in their own locations for their work. And I know everyone is working around the clock and tirelessly to ramp up the availability and supply of what we're doing, and we will continue to move fast to have an effective, efficient, and equitable distribution of the vaccine. We are also continuing to increase the availability of locations where individuals can get it. We now have 7 community pods. These are places that do, say, 500 vaccinations a day, and these are in the cities of Chula Vista, National City, Imperial Beach, San Diego, Escondido, Oceanside, and El Cajon. And these can all be accessed for an appointment via My Turn. Supervisor Vargas in a minute will walk you through the interactive map that shows the locations of these, along with the process you access these via My Turn. Our plan and goal is to bring on 6 more of these community pods or points of distribution in February so that there are more points and accesses for those to go. We also have our 2 vaccination superstations, the one at Petco and the one at Sears, the Sears site in Chula Vista. And this Sunday, our North County sponsored vaccination superstation will open at Cal State San Marcos' athletic complex. We will begin taking appointments on Saturday, and we will begin administering vaccines on Sunday. We are sponsoring this site in partnership with the university, along with some staffing support from Tri-City Healthcare, UC San Diego, and Palomar Health. That site will be open Sunday through Thursday, 9 a.m. to 3:30 every week. And again, appointments are required, but again, that is opening a 3rd vaccination superstation, and we have plans very quickly to get a 4th one up in East County sometime next week. And so we're continuing to add pods, continuing to add superstations, and continuing to ramp up the availability we can. But again, this is all contingent upon the supply of vaccine. And so we are building a system to administer vaccines that we may or may not have. And so we're going to continue our approach to build it out as robustly and rapidly as we can in hopes that the vaccines will arrive. We have told you, San Diego County have mentioned we had a dashboard or interactive scheduling thing we had developed. We decided to wait and go with the state. We didn't want to have people switch systems midway. And so we are in the pilot project with the state of California. This is the My Turn system, and it is presently being used for all 7 of our community pods. We've added a regional map and search function that will make it easier for individuals to find a vaccination site near them. This is very similar. If you interacted with the testing one, you will find it is very similar to that. And we've been working to clean up some of the functionality of My Turn to make it easier with the first and second appointments. And we think that it is functioning better today than it has been. All of the county-sponsored pods are utilizing My Turn. When we bring on the Vaccination Supercenter in North County, it also will work via My Turn. And when we bring one on in East County, it will work via My Turn. And we're in the process of migrating both Petco registration and Chula Vista registration into My Turn. And the aim is so that every one of our sites is scheduled through the exact same process. And we encourage you to go to vaccinationsuperstationsd.com where you can make your appointment. And again, Supervisor Vargas will walk you through the map, the interactive nature, and how you would schedule that up. And for those 75 and older who do not have access to a computer, you can call 211 and they will actively help schedule you for an appointment if there is one available. Again, we're getting significant numbers of calls, and the ability to schedule folks is dependent upon the ability of appointments to be present. And again, we are please asking, this is for 75 and older only who do not have a computer. This is not a vaccine helpline or vaccine complaint line. This is for vulnerable seniors who do not have access to the internet to be able to schedule their appointments. I want to tout two other quick things, and then we will jump into our charts. As chair of MTS, I'm very proud of Metropolitan Transit System, what that agency has done in COVID, continuing to provide help and assistance and the availability of transit to our essential workers and folks that are transit dependent. MTS is stepping up again to help get people to vaccination sites. Starting today, MTS will provide free rides on our bus and trolley network to anyone who has a vaccine appointment for that day. And so if you print off your appointment form and you take it when you get on the bus or you get on the trolley, you can ride fare free to your appointment and then back home on the day of your appointment. Many of our vaccination sites are sited strategically along transit lines to make it easier for individuals to access them and get to them. And we certainly appreciate MTS stepping up to try and make it a little bit easier for folks who may want to utilize transit in order to get to their appointment. And the other update is HEAL. HEAL is a national, H-E-A-L. HEAL is a national mobile health care company with operations in San Diego County. They have come on board and will be helping and assist our fire agencies and Champions for Health in increasing the number of long-term care facilities we can get to on a regular basis to administer vaccines to those. And so we are very grateful for them. With that, let's jump into today's charts. There you can see an update of our vaccine dashboard. 485,900 is total doses shipped to the region. Again, this includes doses shipped to multiple entities across our region. And I know all of those entities are working hard at getting the vaccinations administered quicker and updating the immunization registry to reflect. But there on the second line, you can see on the right-hand side the total doses administered, 269,218, surpassing our initial goal of 250,000 in January. And there you see the breakdown in first dose and second dose and the percentage of population fully vaccinated. And again, as the supply becomes more steady, we get more locations stood up, we think these numbers will move much quicker as we head into February, but solid progress so far. In terms of cases, today we're reporting 1,489 new cases. Again, this is down considerably from where we were not too long ago, with more than 4,000 cases being a not uncommon occurrence there for a period of time. We need this number to continue to come down. We want to see continued downward trajectory in this number. Again, 1 or 2 days does not make a trend, but we've been kind of plateaued there at about 1,400, and we are hopeful that folks will continue to adhere to the public health orders and see this number begin to come down. Again, on the next slide, you'll see here our hospitalization. This is COVID-related hospitalization. You can see a slight downward trajectory, less downward with ICU utilization, a little more downward overall. Again, somewhat encouraging, but we would like to see this on a little bit steeper curve. And then on the next chart, you can just see our ICU bed capacity. And again, the COVID numbers there on the bottom are holding relatively steady. Non-COVID numbers are going to tick up a little bit, and then you see the staffed and immediately available. It is entirely possible that even if the COVID numbers begin to decline, the overall availability will not change. We have to keep in mind a lot of individuals had their needed and necessary healthcare procedures canceled or delayed. And so our healthcare systems are going to have to do a lot of work to catch up. And so we expect a fair amount of strain on our healthcare system as we move forward, as they catch those up and continue to deal with COVID. And then our next chart here is just our loss of lives. Today we're reporting 69 San Diegans who died as a result of COVID-19, bringing our total to more than 2,500. Final chart for the day. This is one you all will be familiar with from the late summer and fall when we were in the tiered system. What you see on the left right there is just the running tally of our unadjusted case rate, and you see where that spiked, 65 jumped to 89, 97, down to 67. The second chart over is our adjusted case rate, and this is where we get the adjustment based on how many tests we're doing. We're doing considerably more testing than the average, so we get a little bit of an adjustment factor for that, and you can see that dropping from 69 to 60 to now 49.6, along with our testing positivity percentage, which you can see moving as well. On the right-hand side of this chart, what you see is where we need to be to go into other tiers. And a lot of you will remember the anxiety for a considerable amount of time about 7.0 for red, and are we 6.9 or 7.1? But what you can see right there is we have to get our case rate per 100,000 down to 7.0 in order to descend into that next tier. That case rate right now is at 49.6. And so that tells us we have a ways to go, which is why we continue to implore the public to please be careful. Let's follow the public health orders, and let's continue our current trajectory. With that, please welcome Supervisor Nora Vargas.
Thank you, Chair Fletcher. We're taking the necessary steps to streamline the process for appointment setting, and this goes hand in hand with the expansion of vaccine distribution and making sure that we have the right infrastructure set as we proceed. We're going to go ahead and, after we heard from the public feedback, we've made sure to enhance our vaccination sites and appointments page, and I'll go ahead and walk you through a couple of slides here so that we can actually go through the slides and see, I can share with you what we have actually changed. So to make an appointment, you go to vaccinationssuperstationsd.com. Once you're there, you're going to scroll down, and you now have the option to choose a vaccination site. You see those two boxes, right? And that is closer to your location by selecting the vaccination site by location button. You can also click the vaccination site by day to view a list of sites that are open on a particular day of the week. In this case, what we're going to do is we're going to click on the vaccination site by location button. It will take you to an interactive map where you can see all the community pods or super stations. Next slide, please. In this map, you can search for locations nearby using your address, zip code, or simply clicking on the map. Once you've entered your address or zip code, you will see the site closest to you pop up with additional details and the location. Next slide. You will see in the site it's a walk-in or a drive-through. If you can go back, I think. There you go. What you'll see is in the site whether you can walk in or a drive-through. You can also want to clarify that when we mean walk-in, it means that this is an actual site where you have to get off your car and you have to go inside to get your vaccine, right? Where you park and you're going to walk up. And because we have to make sure that we remind everyone that you do need an appointment before you come and get your vaccine. All sites require appointments. You can also see the schedule on the site, so you can see the days and times it's open, as well as the address for you to click on. Plus, you have the ability to click on the next box below to schedule your appointment. Next slide. As I mentioned before, folks can actually search for appointments by day by clicking on the scheduled and by day button. So there's a vaccination sites by day as well. If you click on that option, it will take you to the vaccination schedule by that day. where you will see a list of sites that are open. In this case, you see Sunday. I think you're going to put the vaccine chart that has the dates. We're missing it? Oh, yeah, there you go. The Sunday, you see how on the Sunday it says all of the vaccine locations that are open? You can see the list of the sites that are open on this day, their address, their schedule, and the type, whether it's a walk-to or a drive-through. So you can click on the specific site, and it will direct you to the set appointment. It's a little bit, we're doing our best. We're listening, and we're making sure that we are able to adjust these slides as we hear from our communities, and we were trying to move forward. Thank you very much. As it relates to rental assistance, I just wanted to go ahead and remind everyone that this week, the Board of Supervisors voted to expand the emergency rental assistance program for those who have suffered economic hardship due to COVID-19. The county programs allows folks who are facing eviction or are unable to pay their rent to apply for financial assistance if you're in unincorporated areas. These funds can be used to cover rent, utilities, and other household expenses. And so we're doing everything we can to make sure we help support our communities the best we can. So we absolutely ask everyone to continue wearing their mask, practice physical distancing, wash your hands regularly, avoid gatherings with people outside your households. And if you're 75 or older and do not have access to a computer, as Chairman Fletcher shared with you, please call 211 for help connecting with your healthcare provider or making a vaccination appointment at a county or San Diego site. Now I'm going to go ahead and turn it over and do it in Spanish for you. ¿Listo? Muy bien. Como mencionaba el supervisor Fletcher, estamos tomando las medidas necesarias para agilizar el proceso para que ustedes puedan hacer sus citas. Sabemos que ha sido bastante complicado para nuestras comunidades y lo que estamos haciendo es, vamos a trabajar mano a mano con ustedes para expandir la distribución de vacunas, que es sumamente importante para que estemos todos seguros y la infraestructura esté lista. Next slide. Go back to the slide. Thank you. El proceso de citas. Con los comentarios, and it's in Spanish too, so I think we can click on the Spanish site, but if not, when you go to the website, people will be able to do that. Debe estar en español. Cuando ustedes vayan a la página web, vaccinationsuperstationsd.com, van a poder ver la página en español y esta información la van a tener. Pero lo que voy a hacer ahora es demostrarles cómo se va a ver y ustedes lo pueden buscar, ¿ok? Gracias a los comentarios que nos llegó del público, estamos trabajando para mejorar nuestra página de citas de vacunación. Como les comentaba, van a ir a vaccinationsuperstationsd.com. Si ven hacia abajo, van a ver una opción de elegir una cita de vacunación que está más cerca de su hogar. Entonces, eso lo pueden hacer. También pueden hacer clic en los sitios de vacunación por día para ver una lista de los sitios que están abiertos en un día particular de la semana. Si hacen clic a uno de los botones sitios de vacunación por ubicación, los llevará a un mapa interactivo donde podrá ver todos los spots que están disponibles, superestaciones en la comunidad. Creo que no tengo, digo, ahí está, muy bien. Como ven en este mapa, ustedes pueden buscar ubicaciones cercanas usando su dirección, código postal o simplemente haciendo clic a uno de estas orígenes del mapa. Una vez que haya ingresado su dirección o código postal, verá el sitio más cercano a usted con detalles adicionales sobre la ubicación. Verá el sitio que le van a decir que puede ir ya sea por medio de su carro o va caminando, ¿no? Es muy importante que todos sepan que necesitan cita previa antes de ir a cualquiera de los centros de vacunación. Muy importante porque no queremos que vayan a estar esperando, entonces queremos que hagan su cita antes de que vayan. También pueden ver el horario de sitios para que puedan ver los días y las horas en que está abierto, así como la dirección. Como mencioné antes, la gente puede buscar citas por día haciendo clic en el botón de programación por día. Si hace clic en esta opción, los llevará al calendario de vacunación por día, donde verá una lista de sitios que están abiertos y donde estará una lista, en este caso verá el domingo, como aquí lo pueden ver. Página de web está en inglés, pero lo van a poder buscar en español también, así que no se preocupen. Lo que pasa es que se lo estoy enseñando cómo va a ser, pero van a poder hacer clic en el sitio específico y les indicará el programa de la cita. De cualquier manera, estamos haciendo todo lo que podemos en la comunidad para que ustedes tengan acceso a sus citas de vacunación, que es lo más importante. En cuanto a la asistencia de renta, sabemos que muchos de ustedes siguen teniendo dificultades para poder pagar sus rentas. Entonces, esta semana, los juntas de supervisores Votó para expandir el programa de asistencia de rentas de emergencia para aquellos que han sufrido dificultades económicas debido al COVID-19. El programa del condado permite a las personas que enfrentan su desalojo o que no pueden pagar su renta solicitar asistencia financiera. Estos fondos se pueden utilizar para cubrir su renta, los servicios públicos y otros gastos domésticos. Por último, quiero recordarles que si usted tiene 75 años o más y no tiene acceso a una computadora o alguien que le ayude, puede llamar al 211 para que lo ayuden a comunicarse con su proveedor de atención médica o hacer una cita de vacunación en el sitio del condado de San Diego. Thank you very much. Muchas gracias.
At this point, we'll go to your questions, and Drs. McDonald and Dr. Wooten are both here as well for questions. We'll go to the first call-in question.
Matt Hoffman, KPBS.
Hi, for the Petco Park super vaccination site, how are those makeup appointments been going? Have you guys been able to expand capacity beyond 5,000 tests per day there? And I see there's a call for volunteers to work at that site, both medical and non-medical. If people are interested, what kind of volunteer positions are you guys looking to fill there?
The weather, in particular, the extreme winds came in and obviously set us back 2 days. And the intent was to try and expand operations in order to catch those up. I know all of those appointment schedules for those days are being honored. Some will be on today, and some of those will be on Saturday. I don't know exactly how many they've been able to do beyond what they normally do, but I know that they're certainly striving to be able to catch up. The volunteers, the great need for volunteers certainly is medical volunteers, folks with some type of healthcare licensing who might be able to get up to speed to administer vaccines. But there's a variety of volunteers that they use there. Again, everything from check-in to traffic control to setup and breakdown. And so again, we encourage people to go to the volunteer sites we've shared and register, and we will draw from that. All of the sites will draw from that as needed.
And then I know we're hearing a lot about, I know Supervisor Fletcher, you talked about that UK variant, the strain. We saw our first death reported here because of that. I'm just curious to hear from like the medical experts, like, should we be more worried about that now as we're reopening now, or where do you guys kind of see this playing in over the next few weeks?
Yeah, we'll have Dr. McDonald address the variant.
Yeah, thanks for that question. I can just give you maybe a quick update on the so-called UK variant, or the B117 variant. Actually, as of today, we've had 109 confirmed variant cases and 44 epidemiologically linked cases. These are people who are known to have COVID because of a positive PCR test, but we don't have a whole genome sequence result, so that adds up to 153. That's a small number compared to the total number of cases in the county, but we do think that number is increasing, may represent 1% to 2% of all the cases that are out there. And I think if you saw the wonderful presentation that Dr. Martin gave, the modeler from UCSD at our Board of Supervisors meeting back on the 26th, the potential impact of that could be seen in a surge later in February and into March. And so the take-home message is that variant is in the community. It's circulating to some extent, very low at this point, but that the measures that can be taken to control that variant are really the same as what we've said all along. We just make sure we need to do it with strict adherence to wearing masks, social distancing, using only essential activities outside the household. So hopefully that answers the question.
Yeah, thank you. And it's just been the one confirmed death on that?
Yes, there was one individual, a 71-year-old male, who was actually a probable case. This is a household contact of a confirmed case, who unfortunately we didn't have that sample available to prove that it was whole genome sequence B117. But because there was an intimate member of the household who did have that variant, and that individual was pretty much exposed to that 71-year-old, we are confident in assigning that as a probable case.
Gotcha. Cool. Thank you. I appreciate the clarification.
Thank you. We'll go to our next call-in question.
Brandon Lewis, CBS 8.
Thank you. I have two questions about vaccine tourism. The dashboard shows that no vaccines have been given to people outside of the county, but we're getting tips from people at both superstations that it is happening. So I'm wondering if the county is aware of this and concerned about this. And along the same line, Supervisor Vargas has encouraged seniors who are undocumented and live in San Diego to feel confident that they can confidentially get the vaccine. So I'm wondering how the county is balancing vaccinating these vulnerable populations and also avoiding international vaccine tourism.
Well, we're committed to doing everything we possibly can to ensuring that the vaccines we have only go to those who live or work in San Diego County. And so you are required to show that both in the appointment process and when you show up to show some documentation, some identification that you live or work in San Diego County. And so we're doing the best we can. You know, Brandon, it's difficult to verify every single person. You would at some point have to stop the entire process to figure out how do you verify that what they showed you is accurate. And so we're trying to move swiftly and get as many vaccines done as quickly as possible while putting in the best available protocols and procedures, again, to ensure that those individuals live or work in San Diego County. When you're doing hundreds of thousands of vaccines, obviously there's going to be an isolated person who might slip through. But again, we are requiring people to show that they live or work in San Diego County, and we will continue to do that as we move forward.
So just to clarify, because Sharp, who runs the Chula Vista site, said that they're not requiring proof of residency. So that it is confirmed that the county is requiring proof of residency.
Yeah, we're asking people to show some form of identification when they go through that process. It's not a check of citizenship or immigration status. It's just something that says you live or work in San Diego County.
Okay, thank you.
Thank you. Next question.
Allison Ash, NBC7.
Hi, let me start by throwing my mother under the bus. She's 84 years old, cannot operate the internet on her phone, on an iPad, on anything else. She actually relies on me to make all those kinds of appointments and reservations for her. So people like that, we're hearing that they are having a difficult time. They can't, even though this new My Turn website, it seems to be a pretty big improvement, they are not able to even access that. And on top of that, when they call 211, there are long, frustrating waits. What's being done to clear that up? Who's helping these people to get it done?
Well, the number one thing that would help clear that up would just be more vaccines. If we had more vaccines, we'd have more appointments. And if we had more appointments, they would be much easier to get. We are working, again, I think the My Turn site is much improved and is easier, but that won't help your mom if she can't access it. And so in that instance, you call 211. We're increasing staffing significantly to 211. And they are working through and are taking people's information and scheduling them for appointments. But again, you have to have the availability of appointments. And so when you get tens of thousands of calls all day long, every single day, and there's only a handful of available appointments, it really is a challenging situation. And so we're moving staffing, we're increasing staffing on the phone lines. We continue to really plead with the public. If you're not 75 and older without a computer, please don't call 211 for a vaccine appointment because they can't help you. That is for vulnerable populations only who are having a hard time getting through. And so we're going to continue to add staffing. We're going to continue to try and add appointments. And we understand folks are frustrated. We just ask for their patience about we can only schedule appointments and set things up for vaccines we have. And we're continuing to expand rapidly and to request more and ask for more. And we hope over time it gets a little bit easier. But just asking people's patience as we work through this.
We have is Anthony Perro with 10 News.
Hello, I had a question about the staffing levels at the vaccination sites. As far as the need for vaccinators, can you talk about any future plans to help staff all of these vaccination super stations, including that new one coming up this weekend in the North County?
Yeah, so it's a multi-pronged approach. Part of it is using healthcare workers from our partners. So if we partner with Sharp, some of them will be Sharp workers. If we partner with UC San Diego, some are theirs. We're working on partnerships with Script. Scripps, Palomar. I think we're working on partnerships with all of our San Diego healthcare providers except Kaiser. They haven't been interested in partnering with us on one, but everyone else is doing it. And so those places, it's some of their workers, it's some county public health workers, it is some workers who come out of the Reserve Medical Corps, it's some paramedics who have been trained as vaccinators who can help come staff a site on their day off. And then we think the real increase in workforce as we increase the number of sites will come from our EMTs. The state has provided a waiver process where EMTs are eligible to administer vaccines, and we have a robust training program going to train EMTs and deploy them into the site. And so, again, that is a concern, and we have a multi-pronged approach to increase the medical workforce so that we can build out this network and system. But it really is county, our healthcare partners, Reserve Medical Corps, paramedics, EMTs, everyone really coming together to pitch in.
Okay. I also had a quick follow-up question. Is there any concern that the state lifted the stay-at-home order too early? I know that's been a topic since it came a little bit of a surprise earlier this week. Can you talk about any concerns about that if it was lifted too early?
Yeah, I'll let Dr. Wooten address the timing of that.
Good afternoon, and thank you for that question. No matter what the state did, some people will think they did it too early, others think that it was too late. So they made the decision based on a metric, and they stated, and they've always stated, that in the beginning of January they would do a 4-week projection, and if that was greater than 15%, then they would lift the stay-at-home order for any given region. And it just so happens that all of the regions, the 5 health officer regions, with the calculations and metrics that the state used, were above 15%. So that's where we are. Remember that the jurisdictions can be more restrictive for some of the various actions than the state allows, and there are a couple of areas where we are. So we will continue to look at everything very closely, and we are in purple. That's not a whole lot that can happen in purple, except for a couple of modifications with the outdoor percentages of people that can gather, and of course the salons, nails, and barbershops. So that's where we currently are, and we will continue to monitor our metrics as our case rate goes down. Recall, you may not recall, but probably 2 weeks ago our adjusted case rate was approximately 70. Then the next week it was close to 60. This week it was less than 50. So if the case rates, the adjusted case rates, continue to decrease, as well as the daily case reports continue to decrease, we will open appropriately as provided by the guidance from the state and the metrics that they have identified. Thank you.
Thank you.
Okay, we'll go to our next call-in question.
Paul Sisson, the San Diego Union Tribune.
Thank you. We've gotten quite a few different questions about the current vaccination situation. I spoke to somebody just a little earlier today who's had a lot of difficulty scheduling a second dose. She said her and her husband were vaccinated on January 23rd at the Chula Vista Super Site, and were given a piece of paper that said when they need their second dose. Went online to try to schedule that and just cannot seem to make an appointment. I've spoken to others who were vaccinated at the Petco Super Site, and they seem to be getting text messages that tell them when to schedule. There seems to be a little different communication going on from one super site to the next. I wonder if you can explain kind of what's going on there with scheduling second doses.
Yeah, Paul, what we're trying to do is get all of the vaccine sites into the same system, and that'll be the new My Turn system that is up and running. The 7 community pods are in that system. The super station we launch in North County on Sunday will be in that system, and that is where you'll schedule your first and second at the same time. Petco, because it launched first, UC San Diego launched it with their own system, their own scheduling system. and they are working through scheduling everyone who got a first dose to get a second dose. Sometimes they do that on site. Sometimes they give you the piece of paper you mentioned that has a kind of code or link that you go to schedule the second, but they're working through that. And then the Chula Vista site also is doing the same. And we tried to move quickly to stand sites up before we had the unified system kind of all work together. We are working to migrate the Petco site and the Chula Vista site into my turn, so that won't be a inconvenience moving forward. But I just ask folks to continue to be patient and working through for Petco, the Petco site and contact information to schedule your second, and for Chula Vista, the same, different site, but same site and system there to get your second. And I think we'll be able to get all of those caught up and then get them migrated into one system. And so as we really ramp up the volume, I think it'll go a little bit smoother.
The other thing that we heard, can you hear me?
Yeah, I got you.
Yeah, the other thing we heard today was the wait at Petco is a lot longer today than it has been, and maybe even just last week. And just the back pressure from the wind events and everything kind of playing itself out. What's causing these longer waits?
Well, I wouldn't want to speak specifically to a specific time. I wasn't down there and haven't seen, but there is fluctuations that happen. They're obviously working incredibly hard to try and catch up and slot in and get more appointments done in order to get through. But I think we're going to see these fluctuations. You know, you talk to someone who says, hey, I drove right in and I was in and out and, 25 minutes total and it worked great. And then some folks say, hey, I got there at a different time and I had to wait in 30 minutes of traffic to get there. And so I think the Petco site was obviously severely impacted by the wind. They had to reconfigure, they had to realign, and they're trying to catch up a significant number of appointments. And so, any one little thing might set it back on schedule for a little bit. But they're working really hard, and they're really trying to daily assess how they increase the throughput, the flow, and the convenience. And so again, we ask for folks' patience. We're trying to do a significantly large number of vaccines at a number of sites, and there's going to be little hiccups along the way, but they're going to continue to try and refine and improve. But I would most likely attribute it to trying to catch up or some minor thing that might have gotten off a little bit in the reconfiguration.
And then finally, there was a lot of questions about vaccine supply. And can you say how, what kind of dose inventory you currently have on hand, and are you going to have enough to meet the demands of all these additional sites you've announced and are opening soon in coming weeks? How are you going to have enough vaccine supply to run all of this?
Well, we don't know. I mean, we know presently, we believe we have enough to get us through middle of next week, and then we're hoping that more will arrive early next week. And, Paul, it's a classic, dilemma when you have uncertainty of supply. Do you wait until you get the vaccine to build out the distribution network? And if you do that, then you're obviously sitting on vaccines that could be going in people's arms and ready. Or do you build out the distribution network with the hope and belief that it will come? And so I can't tell you with any certainty that next week we will be able to continue expanding, providing more, or next week we might have to come before you and say we're going to have to slow down or shut down some of these sites because we just don't know. What we know is, as a county with our partners, we want to move aggressively. And we want to build out as much capacity as possible so that we can get every vaccine in an arm as fast as humanly possible. And so we're going to keep building out that capacity, and we're going to keep administering vaccines. And if at some point we run out, then we will run out, and we will have to tell people we're going to have to pause until we get more. But I would rather have that happen than have a situation where significant numbers come in and we don't have the infrastructure built out to administer them. And, I think the public understands it is not the easiest thing to stand up. You have to have protocols and procedures and staffing and safety protocols and appointment systems and all of that. And so we're moving forward to build out a very aggressive and very robust network with the hope that they keep coming, but we just don't know at this point.
Thank you.
Thank you. Next question.
Our final caller today is Tommy Sablin with KUSI.
How you doing, sir? Mr. Chairman.
Thank you.
We understand you have been asked for consideration of vaccines for uniformed officers by the President of the Chiefs, the Sheriff's Association, and Chula Vista Police Chief Roxana Kennedy. May I ask, what is your response to their plea for these public servants to get their vaccine now?
We want them to get their vaccines, and we certainly want them to get them as quickly as possible. We are presently following the guidance, which is to do healthcare workers and individuals 65 and older. As soon as we have any slack and availability of appointments, then we will move into the tier of essential workers that are highest priority, which include first responders, childcare, education, and food and agriculture, and all of those individuals will be in that tier. And so the minute we have any availability and appointments from doing 65 and older and healthcare workers, we will immediately get to that group.
But do you understand, sir, their frustration because they're going out, saving lives, doing CPR. And especially Chief Roxana Kennedy is especially frustrated that her men and women, aren't being vaccinated.
Yeah, I understand a lot of people. Yes, I understand folks' frustration. They want the vaccine now. We've got established guidance from the federal government and from the state government that we have to follow. And that says you have to do healthcare workers in 65 and older, and then you can move into that first tier of essential worker. And those first responders are in that first tier of essential workers, and we'll get it the minute and second that those vaccines are available.
If I may, respectfully, is it true that Orange County, Marin County, Riverside County law enforcement have been vaccinating their law enforcement officers? And is it different for San Diego, sir?
You would have to ask those counties. Dr. Wooten has something I think she wants to add here.
For the individual asking this question, I think people should understand that paramedics and EMTs and individuals that do CPR, they were included in phase 1, tier 1, for healthcare professionals. That category even includes lifeguards because they're doing rescues and doing CPRs. So those individuals should already be vaccinated. In phase 1A, it is the remaining category of emergency service workers, which would include pretty much everyone in this room as well. So the people that are doing CPR should have already been vaccinated, and if they have not, they should be vaccinated at any of the locations that have been shared with you today. And then we will open it up to the remainder of the emergency services categories, followed by child care and education, and then food and agriculture. Thank you.
Thank you. We'll now go to our texting questions.
Chair Fletcher, this question is from Carrie Kahn, a correspondent with NPR. It's similar to one you answered earlier. She asks, is it a concern for San Diego County that Mexican nationals are crossing the border for COVID vaccines? Has this been a problem for the county? And what about Americans that live in Mexico coming across for the vaccines too?
Yeah, thank you, Carrie, for that question. We are committed as a county to doing everything within our power to ensure that vaccines go to individuals who live or work in San Diego County. We do have, both in the appointment system and on site, procedures that have been put in place to verify that the individuals live or work here. We're obviously moving at a speed to try and administer so many vaccines that don't make it possible to stop the entire process to verify what every individual is showing you or telling you is 100% accurate, but we're going to do everything we can to give the highest degree of confidence possible that is being met. There are a significant number, hundreds of thousands of U.S. citizens who live in northern Baja, a very significant number of them who work in San Diego County. And so they would be eligible to get the vaccine because they are U.S. citizens and because they work in San Diego County. And we're requesting additional vaccines from the state to compensate for that fact, to say not only do we have the population that you show on paper for San Diego County, but we have a sizable number of U.S. persons or legal permanent residents who routinely cross the border to work in San Diego County, and we're hopeful that we can get additional vaccines to try and accommodate and meet that need. So we will continue to do everything we can to make sure San Diego County residents and workers are the ones receiving our vaccines. Thank you.
Okay, thank you. This question is from Mimi Akala with ABC 10 News. A lot of people have been having issues getting their second shot scheduled. Can people go to any clinic or vaccination site to get their second dose of the vaccine, or do they have to return to the original site where they got the first dose? And she also asks, are vaccines tossed out if people miss their appointments?
So we encourage people to return to the same location to get their second vaccination. They'll be familiar with them. They'll know the procedure and protocols, and also ensure that it's a similar vaccine. And so we are encouraging people to schedule that second dose at the same location they did. And most of those locations, when your first dose, give you instructions for how it is you schedule your second dose if they don't automatically schedule it on site. And then the system we're now utilizing will schedule both appointments at the same time. And so moving forward, we think this will be less of an issue. The second thing is we haven't had a problem of people missing appointments, and we haven't had a problem of extra or wasted dosages. Each of our sites have become very efficient at utilizing the dosages and being able to store those vaccines. And all the sites also have in place protocols where if they have a handful at the end of the day, they have individuals in the proper tier that they can administer them to.
This question is from Cliff Albert with Kogo Radio. With the difficulty people say they are having trying to find open vaccination appointment times at county locations and problems with the My Turn website, can you reassure people, especially those 65 and over who are now eligible, that the ability to get vaccinated will improve soon?
Well, Cliff, the ability to get vaccinated is dependent upon the availability of vaccines. And so we're doing everything we possibly can to get every vaccine we have into an appointment and into an arm. But we don't control the supply or availability of vaccines. And we hope it improves. We know people are frustrated. We're frustrated. We would like to see more vaccines on a regular schedule, and that would allow us, again, to open up more appointments. So we ask people to hang in there, be patient. We are doing the very best we can to, build out a system, and as we get more vaccines, then we'll have more places and more appointments, and people will hopefully be able to more easily get them.
This next question is from Jeff McAdam with Fox 5. He says, weather earlier this week caused the Petco Park location to close. Is the county better prepared for incoming weather, heavy rains tonight and tomorrow, or could there be more closures upcoming? That's the first one. And the second one is, medical workers and people 65 and up have been approved for vaccine. Who is up next? People 50 and up, teachers, and when? And then there's another part. I'll wait to read that after.
So when it comes to the weather, we obviously we don't control the weather, but the Petco site has done everything they can to fortify that location. They think they will be fine. Rain is not a problem. If the wind starts gusting beyond 30 miles an hour, then that could cause some problems with the tent structures that they have down there. So we'll have to monitor, but again, they experienced significant damage by some really unpredictable and unnormal wind levels that happened. They have fortified and rebuilt, and we think they'll be able to do it. The other county sites and county administered and sponsored sites with our partners have not been impacted by the weather, and we don't expect they will be. So we'll have to wait and see, but hopefully we can get through it without any additional interruptions. In terms of who's next, right now we're doing, again, healthcare workers and seniors 65 and older. Next will be the tier of essential workers that includes first responders, education, childcare, and food and agriculture. And we don't know when we will get to that tier, again, because we don't know how many vaccines we will get or what will happen. We know what we're doing now, and we know what comes next.
All right. The third part of his question is, the American Academy of Pediatrics reported that there was a 16% increase in COVID cases in kids last week. Have we seen an increase here, and do we think it has anything to do with the new variant strains of COVID?
You'll have Dr. Wooten address that question.
Thank you for that question. We issue what's called a COVID watch. It's issued every Tuesday, and we have staff has done a very nice representation of the cumulative number of cases over time, as well as by age groups. And since November, we have seen an increase in the number of cases. But overall, during the entire pandemic, we have had about 37,361 cases in the age group of 0 to 19 years of age. The increase is not being impacted by B117 because those numbers are very small. So just as all of the other age groups have increased since November, we have seen an increase in the 0 to 19 age group as well.
Thank you, Dr. Wooten. We'll go to our next texting question.
This question is from Claudia Buccio with Univision San Diego. We know that Latinos are the most impacted ethnic group, but when it comes to vaccinations, only 14% of Latinos have received it. What factors play into this? Do we expect numbers to flip once vaccination opens up to essential workers? And what is the county doing to ensure that vaccines reach Latinos to control the spread of the virus? I'll read the third part and fourth part.
Supervisor Vargas will answer for you.
La pregunta específicamente es sobre la comunidad latina y cómo es que estamos, perdón. La pregunta específicamente es sobre la comunidad latina y cómo es que hay solamente un porcentaje muy pequeño de la comunidad que se está vacunando. Parte de lo que estamos haciendo es que estamos informando a las personas para que la gente pueda tener acceso a sus vacunas. Como pueden saber las personas, muchos no tienen acceso a sus médicos, entonces lo que estamos haciendo ahorita es trabajando con las comunidades. Yo sé que hay programas, por ejemplo, el Latino Health Coalition aquí en San Diego está trabajando para que la gente sepa y no tenga miedo, están trabajando y pidiéndole a las personas pues, que les ayuden a sus vecinos. Por medio del condado lo que estamos haciendo es tratando de buscar no solamente cambios a la página web, pero buscando información para que cuando hablen al 211 les puedan ayudar si tienen 75 años o más. Y así que estamos poco a poco cambiando el sistema, pero más que nada lo importante es, pues primeramente, darle información en español, en su idioma y más que nada, pues que la gente sepa que la vacuna es segura, que es confidencial. Y ha habido muchos rumores de información, que la información de cada persona se va a los medios de las policías, etcétera. Eso no está sucediendo. Por favor, no tengan miedo, apúntense y vayan a que les den su vacuna.
Okay, she also asks, who is next on the list for vaccines? Will it be by job type or age? And she asks, people without an appointment are lining up outside of vaccination sites to see if they can get a vaccine. How are extra vaccines distributed at the end of the day at vaccination clinics or stations?
Okay. Son varias las preguntas que me hacen. La primera pregunta es sobre específicamente quién sigue para que le den sus vacunas. Entonces, todo el personal de salud es la persona que debe tener ahorita sus vacunas, número uno. La segunda parte son las personas de 65 años adelante. Después de eso, la siguiente fase va a ser trabajadores esenciales, que vienen siendo aquellos en la educación, los que cuidan a los niños, las personas que trabajan en los agricultores, y todos aquellos que tienen algún tipo de ayuda, digo, que trabajan en las comunidades directamente. Esa era la segunda pregunta. La tercera pregunta es que está yendo la gente a los sitios de vacunación y están haciendo fila. Les pedimos, por favor, que no vayan a los sitios de vacunación si no tienen una cita previa. Es muy importante que las personas tengan una cita previa antes que vayan, porque si no, pues van a estar esperando por mucho tiempo y no hay vacunas extras todos los días. Entonces, lo que se está haciendo cuando hay vacunas extras o que alguien no fue a su cita o algo, tenemos una lista a la que ya se le otorgó esa oportunidad de poder ir para que se le dé vacuna. Así que, por favor, no vaya a los sitios de salud si no tiene su vacuna con su previa cita para vacuna.
Yes.
Okay, thank you.
Thank you. Go to our next texting question.
The next question is from Taryn Mento with KPBS. Why is the county continuing to use both MyTurn and SDIR? And reporting delays have been a concern before. How will the county and other providers be able to manage data entry for both? And third part is, how exactly is the state using these two data sources to inform vaccine allocations in the county? Are they prioritizing counties based on rate of use or some other metric?
Yeah, so My Turn and SDI are fundamentally different things. My Turn schedules an appointment and directs you where to go and gives you instructions around that. SDIR, San Diego Immunization Registry, is where all immunizations are traditionally entered into, and so they do different things. We are working, and I'll have Dr. Wooten comment on some of her efforts to work with providers to increase the speed by which people get that information entered into the system. Some of the backlog, again, is that delay of people not quickly entering things into the system, and part of that delay could be in some entities are sitting on vaccines that they have not utilized. And so Dr. Wooten and her team are working through with all the providers an approach designed to speed up the distribution and actual injection of the vaccines and make sure it shows. As it relates to how the state is making their allocation criteria, you would really need to ask the state that question. Dr. Wooten.
Thank you, Chair Fletcher. As was seen on the, we showed earlier the number of vaccinations that have occurred, which were, well, how many vaccines were shipped to the region, how many first dose only, how many second dose only, and then the total. So we met on Monday evening with all of our providers, and after that sent out a survey. But what we were trying to identify is there a gap? What is the gap between vaccinations that have been administered and what's been shipped? And what we have begun to elucidate is that some providers are keeping vaccines for the second dose, and we do not want that to happen. We want to get as many doses in arms as possible, and people will get those second doses. The second is we found out at least one provider was not entering into SDIR, but was entering into the state's care system, California Immunization Registry. So we're trying to resolve all of the discrepancies in the numbers that have been administered, the numbers that have been left over, and we will have an updated report later today or tomorrow morning. Thank you.
Dr. Wooten, if you could just stay there. This question is from Carlo Cicchetto with News 8. A lot of people over 50 with pre-existing conditions are asking why they haven't been given a greater priority in vaccinations. What would you tell them?
I would tell them that we are following the federal recommendations that were originally developed by the National Academies of Sciences, and then recommendations made by the Advisory Committee on Immunization Practices. That is the committee that is an advisory group to the CDC. So originally there were 4 phases. The first 3 got collapsed into phase 1 with 1A, B, and C. So, and we've showed the information, actually it was showed earlier. Individuals that are 50 and over, thank you, that's not it, but individuals that are 50 and over are included in Tier 1C. So you've heard the supervisor say we do not have enough vaccines. So that's why, and the federal government knew that at the onset. So that's why the tiered approach was developed. So we can vaccinate those at highest risk first. So right now we are on healthcare providers, and that's a broad healthcare personnel is a broad definition. Then 1B under phase 1 includes those individuals. We started out at 75 and above, and now we've gone to 65 and above, and then going to the 3 essential worker categories that we've mentioned. 50 and above, or 50 actually to 64 years of age will be the next age category, followed by individuals that are 16 years to 49 years of age that have high-risk medical conditions. So as we've stated earlier, we just need to encourage people to be patient, and your turn will come. Thank you.
Thank you.
Thank you, Dr. Wooten. That concludes our media briefing for today. Our dashboards will continue to update along with the regular information that is shared on the county website, and we will be back with you next week for another update. Thank you.